What's up, guys? John here. Titan Talk Tuesday. Great week again, man. Love when this day comes every week. I know we're done with pretty much Tuesday, and we're moving on to Hump Day, which is Wednesday the next day. We got a lot of great information I always cover on Titan Talk Tuesday, and this week is not going to be anything different. I've got a lot of good information from you guys from PT 141, Therapy of the Week. We're going to talk about that. Oral versus injectable therapies. Needle gauges, like which one do you use? I get that question a lot. A little bit more about Amazon, poll question, and a lot more. So without further ado, let's just jump into it. Let's go. Titan Talk Tuesday. Let's roll. So the first thing we're going to cover today is the Therapy of the Week. Therapy of the Week. Gotta love it, right? Therapy of the Week this week is PT 141. Bromelanotide. Okay, that's how you say it. It's a peptide. Now you're asking, what does this peptide do? So PT 141 is good for sexual function, right? To up sexual function and libido for males and females. This is FDA approved. So it's went through all the clinical studies and got approved by the FDA. And we know it works. It works very well. And like I said, for males and females. What was it FDA approved for? So it was actually FDA approved for female libido enhancement because females have a lot more problems with libido enhancement, orgasms, and all these other good things that come with sexual pleasure, right? So, and obviously, if you're a girl, you want to have the same pleasures as guys, or guys want to make sure that their wives or girlfriends are having a good time just as much as them. I mean, I do. I want to make sure that, hey, listen, Sharice is feeling just as good as I am, right? And she's getting pleasure out of it, not just there for me. You know, I think if you get a good relationship, you want them to feel just as good as you do. And that's on an energy level, like a mental level, and sexual level. So this is something for females and males. Now, the way that it works, because you're going to say, hey, listen, for us guys, you know, we got Viagra, which is sildenafil. We have Cialis, which is tadalafil. We use those, and they work pretty good, you know, at that point. So what's it going to be any better for me as a guy? Because girls, I mean, those work too on them, right? The way that they work, specifically the regular ED medications that are out there, like sildenafil, which is Viagra, or tadalafil, which is Cialis, they work on the vascular system, right? So the way that they work is the blood flows down to the extremities. And originally, these medications weren't even made for ED. They were made for blood pressure, all right? And it was just another side effect to the medication where the blood went down to the extremities and erections started for guys, like very powerful erections, specifically sildenafil, which is Viagra. And at that point, you know, it was at that point they seen, oh man, this is going to be great. You know, guys need this. ED's a big thing out there. And, you know, this is what we're going to market it for. This is what it's got FDA approved for. Originally, sildenafil, Viagra. So one negative side effect, I would say, that comes from sildenafil, which is Viagra, or tadalafil, sometimes it could cause headaches. It could cause stuffiness in the nose, flushing. There's some different side effects that could happen from these ED medications. And this happens to guys and girls the exact same way. Now, there's other things you can do to alleviate these things, dosages, Advil. There's some different things you can add in that could take away those negative side effects. And still, a lot of the time, I would say 99% of the time, guys don't care. As long as they're getting the result, the erection, the powerful erection, they feel like Superman, they're doing what they need to do. They usually don't care about those negative side effects. And usually sildenafil creates a lot more than tadalafil. So Viagra versus Cialis. But sildenafil works a lot better as far as right away maintaining an erection, where tadalafil, you need some sort of stimulation of some sort of touching, feeling, you know, where Viagra, it could be, you know, the bleep of a wind passes by you and you're up at full attention, ready to go, and there's nothing by you can do anything with. So you're going to ask, like, what else can I get out of PT 141 that's going to do me any better? For one, females, hands down, they're out there. I know they've tried other ones before in the past, but they haven't had really good results, okay? Where this one has great results. And it has great results, like I said, for females and males. Now, the way that it works a little bit different than Viagra or Cialis. And you're going to ask me how? What's the difference? Well, like I said, Viagra and Cialis work on the vascular system, blood flow, right? And you're like, yeah, that's cool. Well, PT141 works on the nervous system. So the brain, actually, okay? And it creates, these impulses, they say with dopamine and stuff like that, where it will increase arousal and libido effect, not just erections. So at that point, you have libido. Whereas with sildenafil or tadalafil, you could take this medication and really not have the libido. You might have the drive, you might have a little bit of erection, but you have super drive, the libido, like wanting to have the sexual pleasure. You just know you can get up and you can do that and you're good to go. And then after the first time, you're probably like, all right, well, it's up, and that's it. And you're really not getting mental stimulation out of it. Whereas PT141 is great because it's working on the nervous system, which is the brain. Now for females, this is pretty important because at that point, females are more mentally driven sexually than physically driven, where guys are more physically driven than mentally driven. So at that point where PT141 comes into play and working the nervous system and the brain is really going to give you the effect all the way around and help with orgasms, because orgasm can be mental and physical at the same point. And this will be great because you can get that from this peptide therapy. And like I said, it's FDA approved, real simple and real easy to do, real simple and easy to take. You can take this by injectable, you can take this by oral form. I know there's some nasal sprays out there, but I we don't really do those. I don't really recommend those. I've taken all the different forms. Obviously, the girls have taken the different forms, so we know how it works. We know that it works really good. And you can mix it with different things. So, whereas we have Cupid's Candy, and you can do PT141 by itself, and you can do an injectable subcutaneously, or you can do an oral form by itself, or you can mix it with our Cupid's Candy. So Cupid's Candy, you're getting PT141, so you're getting the nervous system involved with libido effect. It will have tadalafil, which is going to work on the vascular system. So you're getting vascular and nervous system working together synergistically to give you a way better result. For libido-wise, erection-wise, you should be a lot stronger. Females, the exact same thing. It also has oxytocin in it. So oxytocin is the chemical compound, like the bonding compound or hormone, they say. And it should bring down inhibitions, bring you closer together. So you have all these great effects that will help bring your status in the bedroom up to a whole new level, like superhero status times 10, okay? And they work really, really well. So if you guys are looking to increase your sexual pleasure, your bedroom enhancement, like we like always talk about, and who doesn't, right? I do, Charisse does. Even though I don't have to take them too much, I have taken them and they work great. And all the feedback we get, obviously, from our patients is they love them, right? That's why they're a top-selling therapy. That's why we want to make sure it was therapy of the week. And usually people are like, oh, I just want Cupid's Candy. But there are patients that get PT141 by itself. An injectable form is going to work a little bit better, but the oral form works great, especially mixing with tadalafil and oxytocin, the Cupid's Candy. You'll get a 3-time effect that will actually work even better. So where does it come from? PT141 was derived from melanotan 2. Melanotan 2 was a peptide 2 as well. It was good for skin pigmentation, so you'd actually get a tan by injecting this without having to go in the sunlight and stuff like that. So they took this sequence out of there because the other side effect was erections. So spontaneous erections by males, libido enhancement by females. So they took that sequence of that peptide, PT141, and that's when they started going to clinical trials with it. And at that point, got it approved. They got approved in June of 2019. And after that, man, it's been history. It's worked very well. And it's a big one because, like I said, a lot of women deal with sexual dysfunction, okay, or can't achieve orgasms, whether it's mentally or physical abuse has happened to them, some sort of traumatic abuse or something that's happened to their bodies or personal. And at that point, they just can't get there, and they get no fun out of the bedroom. And that shouldn't be like that. Like, we're literally put on this earth to procreate through God. That's why we have our sexual organs and stuff like that. That's what we do, right? And usually, I would say the bigger percentage of the population usually does have a good time in that circumstance, but their performance isn't all the way there. Even guys, Erectile dysfunction can happen from a number of different things, even for females, from medications, right? Like blood pressure medications, SSRIs, antidepressants, and it handicaps you. And then at that point, you start getting in the back of your head, if it ever happens to you, if you've ever had erectile dysfunction, or you've ever had yourself go limp during sexual intercourse, you start getting in your mind, and then it starts messing with you. Like, hey, listen, can I do this? Am I going to be able to do this? And it's one thing when you're with your partner, I guess, that you've been with for a long time or married with. But if you're a single guy, or you've just started dating somebody, this could be a very, very bad thing. And even with your partner that you've been with for a long time, because if, let's say you're a guy and you have erectile dysfunction and you're with a female, whether it's your partner for 12 years, like Sharice is my married partner, or I'm just going out and meeting people. When you get down to the nitty gritty and this starts going into effect and you start having these problems, it raises a number of questions with your partner. Is it me? Are they doing something with somebody else? Or is there something wrong with them? There's a number of different questions that might be going through their head. And at that point, you're asking yourself in your head, like, oh man, I hope she don't think it's her. Or, you keep telling her, like, it's not you, it's me. Like, oh yeah, right, it's you, right? You're a guy, you should be having no problems with this. I think I'm sexy, I put on this lingerie for you, and this is what you do for me. Just a lot of problems. And girls the exact same way. Guys especially, like, the older guys, when they start TRT or hormone replacement therapy, their levels start getting optimized again. They start getting young at heart and young below the pants. So at that point, they want to have sexual intercourse more often probably than they usually did before. And then the partner, right, she's not up to that speed, right? Her hormones might be off a little bit or whatever it is, and she doesn't want to have sexual intercourse. And the guy's just raring to go. And he's like, well, what do I do at this point? And this could cause him to go outside the relationship. This could cause him to look at other things, whether it be porn or giving somebody attention that they shouldn't be giving attention to because of these issues. So it's always good to have a good relationship sexually with your partner, not just emotionally, but sexually too as well, because I think they go hand in hand. And I think they bring each other together emotionally. They can be on the exact same level, and they can have pleasure together. And that's really what it's all about. It's having pleasure with your partner, performing at optimal levels, feeling your best, right? So that's what we always preach. That's what you guys should do. So PT141, bromelanotide. It's a long one. It's a tough one. But this one is a very good one for males and females. Works on the nervous system. Great for libido enhancement. So you guys should have stronger erections, especially for guys. More frequent erections probably too as well. For females, you hopefully can achieve orgasm, have the drive and libido to go. It's a great one. So you can get it by itself, PT141, by injection, by oral form, or you can even get it in Cupid's Candy, which has bromelanotide, PT141. It has oxytocin, and it also has tadalafil. So you're getting to work on the nervous system, the vascular system, and you're getting that bonding hormone to help you guys just become together, a more stronger relationship and partnership, and in the bedroom especially, okay? So that should both bring a smile to both your faces. And you guys can use these therapies together, which is really cool too. Okay, so now we've covered the therapy of the week. Let's get into injection therapies versus oral therapies. And it kind of goes right along with what we were just talking about, right? We're talking about injections work a little bit better than oral therapies. Now, the reason you would do an injectable therapy, and let's talk about vitamins and amino acids, okay? There's a big difference. If you were to take an oral therapy or oral over-the-counter branched-chain amino acids, let's just put that out there because that's a pretty common one. You're going to take it orally, you're going to have to drink some, and it's going to do a couple of different things, getting broken down the gastro tract, not being absorbed as much, you're not getting the amount that you may need or want, or the optimal amount, so you're not getting the desired effect or the best result that you can get out of it. You also don't know possibly what's in there. It could be spiked with protein. All these different things happen, right? Because it's over the counter. Where an injectable therapy has to come prescribed. It has to come from a U.S. licensed pharmacy. That's why you don't see injections over in GNC or a big box vitamin, amino acid, or supplement retailers, or you shouldn't. But you won't see those things there. And the reason is because it's doctor prescribed and comes from a U.S. licensed pharmacy. And the reason is because injectable therapies have to be sterile. They have to go through different testings, and this has to be done because you're injecting it in your body, right? You don't want to be injecting something that's contaminated or bad for you because you're going to have a negative effect or something that happened to you, okay? So that's really where the difference is, where injectable is going to get a better transportation rate and a better absorbency. What does that mean exactly in layman's terms? That means that you're going to take in more of what you're putting inside your body, and it's going to hit the bloodstream faster, which is going to get you a better result a lot quicker, and you're going to absorb a lot more of what you're intaking. So injectable therapy versus oral therapy. Injectable therapies are always the best way to go. Now, with some therapies, you can't have an injectable version. Like, we would never prescribe an injectable ephedrine. Now, there's injectable ephedrine out there, but we would never give that to a patient because it can be dangerous, super dangerous, okay? So at that point, you just want to look at the best possible ways. But when it comes to vitamin amino acid therapies, man, you're not going to get a better way to do it than injectable therapies. And we offer all those therapies, and all the different things we offer are nationwide service. All you guys got to do is call or text 727-389-3220. You guys can ask us all the questions about these, whether it's hormone replacement therapy, vitamin amino acid injectable therapy, weight loss therapy, libido enhancers or bedroom enhancers, peptide therapies like the peptide we just talked about, a lot of different things. Blood work nationwide. You're going to be able to ask about all these different things. And the best thing about it is like for PT141, which is a peptide, you don't need any blood work done for that. Okay, all you guys have to do is fill out the new patient paperwork. You're going to see our medical provider, and the pharmacy is going to ship directly to you from the pharmacy to your doorsteps. No medications come from Titan Medical Center. So at that point, you guys will be able to get hooked up and feel your best and look your best. And like I said, injectable therapies are the best way to get it, absorption-wise and transportation-wise. So let's go into the next one, because this falls right step by step. When I was thinking about these topics today, you know, it just so happened that these things were just lining up. They went right together like peanut butter and jelly, baby. Gotta love that. So the next thing is what gauge needles do I use, or do a patient of Titan Medical Centers use for their therapies? Now, it's pretty simple and pretty easy for most patients. And you guys will probably recognize this if you guys are patients. So there's two different types of needles that you're probably going to get. One is a 30 gauge 1 ml half-inch needle. So what does that mean to you? That means that this thing is 1 ml, which is 100 units equals 1 ml, and it says right there on the back. The next thing is that it is a 30 gauge needle. That means how big that needle size is, the bevel specifically, and then how long the needle is, a half inch. So it's going to be a half inch needle, 30 gauge bevel, and the syringe body is 1 ml or 100 units. There's a couple different ways these syringes come, but this is what you're going to get from Titan Medical Center as far as your insulin needle, right? These are insulin needles, not just for insulin, but that's what they call them. So it's a BD 1 ml, right? 30 gauge bevel needle that's a half inch long. And this is good for a number of different therapies. From our vitamin amino acid therapy, so B12, Hercules Potion, Titan Complete, branched chain amino acids, Titan Serenity, Titan Ultra, PT141. So this is what you would inject with if you were to get it subcutaneous. And it's real small. I mean, you can barely even see it on the camera because it's so small. You know, but in feeling wise, it's virtually painless. That's the legal term I have to use. It's virtually painless. So at that point, you're really not going to feel it too much, okay? You're really not going to feel this. It's going to go in very easy. People that are scared or have a phobia of needles and say, I can never do this, I can never do that. They literally, when they do take this injection, they're like, oh, that wasn't so bad, or I didn't really feel that. So, and once they get over it and then they start getting the benefits, it's really nothing at all. You know, with this, you know, I take at least about 10 of these bad boys a day. And you could say, wow, that's a lot. But really, I mean, it's not from what I'm getting out of it. So it's really not that bad. And pain-wise, I don't feel any pain with doing this. You can use it with a number of different therapies. PT141, specifically we just talked about. Hercules Potion, Titan Complete, Titan Serenity, Titan Ultra, AOD, CJC. You get it, right? You guys are, site injections. Okay, so that's another good thing. So TB500 or BBC157, you can inject this closer to the area. Where TB500 works systemically, you really don't need to, but it's always a good thing to inject closest to the area. Also, with Hercules Potion, site injecting. So there's a number of different videos I have up on our YouTube page that shows me how I inject to these different spots, whether it be biceps, triceps, chest, so pecs. A lot of people like Drew and stuff like that inject this in their calves, legs. Girls go glutes, traps. I've seen this pretty much in every muscle. Now, would I put this in some of those muscles? Probably not. Chest, biceps, triceps? Absolutely. Now, if you were to inject this in your deltoid, which is your shoulder, and it was like, let's say, Hercules Potion, it's going to work throughout the body. The only difference with the spot injection, it's immediate gratification. It's a little bit more intense. So you should get a better result by spot injecting it. Not much more of one, but you definitely will see a little bit of a difference. So that is a 30 gauge, 1 ml, half-inch BD needle that we use with most of our therapies. Or you do as a patient. Or would. The next one, let me get the 23 gauge needle. Now this one is a 23 gauge, 1 inch, 3 ml needle with syringe body. Now, usually if you guys get these, it's going to be a BD. It's going to come in a green package, so they're all color-coded by sizes, usually. Let me take this out. So this is used for oil-based therapies. Oil-based. You're like, what is oil-based? Well, all the vitamin amino acid therapies that we have and stuff like that, or in the peptides, are water-based, and you're used with an insulin syringe. This is for oil-based. So testosterone, right? So if you're injecting testosterone, this would be the needle you would probably use. Vitamin D, which is another oil-based injection. And it's usually going to be 23 gauge and 1 inch. So you're saying that's a little bit bigger, John. Yes, the bevel is bigger, and it's a half inch longer than the half inch. Okay, it's 1 inch long. And it's got 3 mLs on the body instead of 1 ml. It's a little bit bigger in circumference, and that's why it will hold more of your medication. So at this point, you'll use this to usually inject your testosterone replacement therapy or vitamin D. The reason, okay, so here's the big reasons why you would use this over a 30 gauge needle to inject. Now, there are some people out there that do subcutaneous testosterone injections. I wouldn't recommend it, but there are some people out there that do it. That's fine. The difference is with the bevel being bigger, and what I mean by bigger is the bevel in size being bigger. 23 gauge is like, you're saying a number wise, well, 23 gauge is smaller than 30 gauge. Well, with gauges and needles, the lower the number, the bigger the bevel. The higher the number, the smaller the bevel of the tip. So at that point, the bevel is going to be bigger, and then you can put a lot more medication in here. The reason is because you might be taking in 1 ml or 1.5 mLs of, let's say, testosterone or testosterone and vitamin D in the same syringe. And to pull it, so that means taking the medication out of the bottle, it's going to be easier because that bevel is going to be bigger and can take a thicker viscosity. So it's a thicker medication. And then also when you inject it. When you inject it in, because of the viscosity of the oil, it's going to go in a lot easier than it would with that 30 gauge because the bevel's bigger. And you're pushing it through a bigger hole. So that's the real big difference between the needles. I get the question all the time. And I get a lot of people that come back to me and they don't ask questions, or they should at that point in time, is they get both syringes, these in their package. Okay? And they start injecting their Hercules Potion or whatever it may be, their vitamin amino acid, with the 23 gauge 1 inch needle. This every day injecting like that is probably not going to feel so good. 1-2 times a week with testosterone is probably not going to be that bad. But if you have to inject Hercules Potion or Titan Complete and all these different things with this big needle, you're probably going to get a little bit of sore. All right, you're going to get a little sore. You might be a little like, I feel like a pincushion, but if I injected myself with these all day, I'd feel a lot worse as far as pincushion. They're going to go a lot deeper. They're going to have a bigger gauge, so it's going to be a bigger hole that's going in you, okay? And it's not going to make a huge hole in you, but it is bigger in size. So when we put them next to each other, I'll show you guys so you guys can see. So you guys can see. I don't know if it's really clear, but You guys can see it really good like that, right? 23 gauge and a 30 gauge. Okay. And the bevel tips. Oh, there we go. You guys can see that, okay? So that's the difference. So I wanted to show you guys this because I get a lot of questions about, what needle should I use, or is this gauge going to be better than this gauge, or what should I do? So these are the most common used needles and syringes here at Titan Medical Center. 23 gauge, 3 ml, 1 inch BD needle and syringe, and a 30 gauge, 1 ml, half inch needle. Okay. So if you guys have any questions about these needles or syringes or what you should be using with your therapies, that's why we're here for you guys. We're here to help you guys. We're here for support for you guys. So we want to make sure you guys are doing things right? You're not having any pain and you're getting optimal results. That's why you're coming to Titan Medical Center. You're here for results, healthy, long-lasting results. So we're here to help you get them. We're here to help you direct you through these injections or your therapies of whatever they are. Okay, and if you have any questions, please call or text 727-389-3220. There is never a dumb question, especially when we're talking about injecting yourself and stuff like that. We want to make sure you guys have proper education, proper training, to the point where, listen, we have videos you guys can watch. We can walk you through these things. It should be, I don't want to say simple, but it should be a lot easier than what you're expecting, okay? And we should be able to walk you through things. And literally 7 out of 10 patients that come to Titan Medical Center have never done an injection in their life. They have never touched a needle and injected themselves and wouldn't even think about it until the point where they come to Titan. And literally, when I started Titan Medical Center, I tell this story all the time. I was really into the injections as far as vitamin amino acid injections. We were the first to really bring them out. Nobody was really doing them. I mean, B12 has been around forever, but I'm talking about the blends and the amino acids and all these different things that are great for your body in all different directions. This wasn't being used, and people told me I was crazy. Like, they're not going to inject themselves, not going to inject them. Well, here we go 9 years later. And it's super successful, knock on wood. And hopefully we keep rising. But that's the reason why, because people will get a lot better result. I mean, it is what it is. They're going to get a lot better result from an injection, especially if it's good things that are going to help their body improve, whether it be physically, internally, mentally. They're going to get a lot better reaction, a lot better result. So that's the lowdown on the needles and the gauges. Like I said, there's different ones out there, but those are the most common ones used and the most common ones you'll probably get with your therapy packages. And if you have any questions, call or text.
Seen some of the comments for the Instagram?
No. Let me get on here and let me see some of the comments.
Ching Seattle said it's simple. Those are sissy boys.
I don't see anything on here.
You gotta scroll a little bit.
Yeah, so sissy boys are right. So, I mean, listen, you're not a sissy if you don't want to inject. I've seen some of the biggest guys in the world be literally scared of needles and scared of injection, pass out during blood draws. Okay, I've seen it in the office. I've heard about a lot of different stories. I know people personally. But, especially with testosterone. So, usually testosterone is best, especially for a guy, is when it's injected. Now, girls, maybe not so much. But guys, yes, 100%. And there's an oral version, there's creams and stuff like that. And they work okay, but injection is always going to work better. It's more controllable, even better than pellets. I've seen pellets get a steam, but once people get on pellets, you're on that ride for a long time until those pellets are gone. Then you have to go back in, get the incision, and you're doing it over again. Where this is more controllable. You can control your dose. You can stop if you need to. You can up the dose. Whatever needs to be done, you can do. But the absorbency factor too as well. And most of these people that have the phobia start with an oral version or a cream. And they start feeling the benefits. And they always ask, like, oh, you think injection is going to be a lot better? And I'm like, yes, it's going to be better. So once they start and they do their first injection, they start feeling the benefits of that, then you know what? It becomes routine to them. And they really have no problems with doing it. So that's kind of where it falls into play, I do above the upper thigh. Okay, so Ching Seattle said he does it above the knee and the upper thigh. That's a pretty common place for some people. You can do your legs and you can sit down and you can watch when you're doing the injection. So you can sit here, you're nice and relaxed, and you can go straight in your leg and really not have a problem. Now me, I don't like to do my legs. I just don't. Some people do, some people don't. If you're a newbie, I really wouldn't recommend it. And the reason is because there's a lot of nerve endings on the leg. There's a lot on the outside and the inside. And, if you hit those, or if you hit something wrong, let's say, and you're not going to kill yourself, but if you hit something wrong, you might be sore in that leg for a couple days, 2, 3, 4 days. And at that point, are you going to be able to walk straight? You're going to be limping. You're like, oh. If it's in your glute, you're going to really have no problems. If it's in a leg, but listen, if you've been doing this and it's working great for you, like Chink Seattle is doing, then at that point you can do it. And it should work out really well for you at that point. So, hey, listen, do whatever works best for you. If you're starting out, let us direct you and help you out through that process so you can get the optimal results and feel your best and not have any issues or pain, okay? So that's the big thing. All right, so more Amazon craziness. Man, oh man. Feels like every week I talk about something about Amazon, whether it's here or with Big Drew on Titan Lifestyle. But I see these things all the time, like especially the last couple of weeks. So a former Amazon employee was arrested and charged with fraud, accused of issuing himself $96,000, $96,500 actually, in refunds to himself and others. It's just crazy. So this guy was working in Tempe, Arizona. He was one of the guys behind the thing that was basically could give refunds. And he refunded himself and these other people this much money. And it's just funny because this guy is also in trouble for another securities fraud thing going on. So this guy's in a world of trouble. He's in a world of trouble. Okay? He's definitely in a world of trouble. And that's the thing, like, if you're going to do something wrong, listen, you're probably most likely going to get caught these days. There's so much tracking and what's going on. And this guy set up false businesses and all types of things to try to cover his tracks. And it didn't do anything good for him. They finally found out. They were asking this guy about it in March, or right before March, and at that point he wouldn't answer. He quit in March, and they passed over this evidence in July to the FBI, and the FBI went through with the arrest and got him on all these things. And last month, another employee that worked in the finance department for Amazon also got arrested by the SEC. And that was because she was doing insider trading. She had information that she was not supposed to do anything with. And if you get this inside information and you start trading on this information, that's insider's trading. $1.4 million is what she got out of this insider's trading, whether she was trading stocks or whatever it is. It's just nuts. So Amazon, they've been on the forefront of these headlines the last couple of weeks, from employees doing other things to people's accounts and messing with things, or taking bribes and all this stuff. I mean, Amazon is what, a couple $1 billion company. I don't even know, billions of dollars. And at that point, they have some of the best software out there. They're going to probably track these things and be able to find you. So if you're working for Amazon, I wouldn't recommend doing anything wrong to them or on premise. All right, guys, that's just crazy. It really is. Yeah. So the next thing. So COVID is back. So COVID is back again. I don't know if this thing is ever going to go away. They're having spikes again in Europe. They're having their supposedly second wave. Obviously, you guys seen the president of the United States. He caught COVID. Wife caught COVID, and a whole bunch of staff caught COVID. At that point, he's already out. I mean, the cool thing about this, if this is true and he caught it and everything went on like that, is they gave him some of these experimental drugs, not even approved by the FDA. That's pretty cool. In stage 2, some of these different things like Regeneron, which was like an antibody therapy that was supposed to attack these different these cells, or excuse me, the virus in these cells, and hopefully get rid of it and stop the viral load from getting as high as it is. So hopefully not causing the inflammation in the body. I mean, he was on dexamethasone, which we talk about too as well. And that's what I want to get into, is dexamethasone. So dexamethasone is getting a bad name because of this COVID deal. Dexamethasone has been around, or Decadron, has been around for a long time. Been used in a lot of different things, okay? And at first, when COVID came out, the WHO, the World Health Organization, they basically gave guidance on not using corticosteroids. So corticosteroids are like dexamethasone, hydrocortisone, these different things. And with cortisone or dexamethasone, these are not anabolic steroids. They're corticosteroids. They help with inflammation in the body, immunosuppressants too as well. So that means they can affect the immune system and suppress the immune system, but they're there to take down inflammation. And I know Tsikouris was on dexamethasone for at least 3 to 4 weeks because of COVID and stuff like that, because of how bad her inflammation was and the walking pneumonia and all that. Great drug if used properly. And what I've seen people being ignorant. People are very ignorant. And when they hear of steroids, they automatically think anabolic steroids. He's on anabolic steroids. And it was just funny because I seen like the trending hashtag roid rage. Like, come on, man. Roid rage? It's not even the same level. Corticosteroids, anabolic steroids, two separate things, okay? Corticosteroids are not going to get you big. They're not going to give you lean muscle mass. They're not going to give you aggressive. They're just not. So, people should really learn about some of these different things. And people were saying, well, the only reason people use dexamethasone is when people are really bad with COVID. Dude, dexamethasone was along way before COVID and was used in a number of different ways. And it didn't have to just be when people were hospitalized. So if you guys are going to talk about these different medications, or people out there are like the news and some of these people just throwing this stuff out there, they should really get their facts straight. All right, can you recommend a good fat burner and appetite suppressant? Seattle for sure. So our ECA Stack Plus, ephedrine, caffeine, aspirin, B12, and chromium. It's an oral capsule. Remember we were talking about oral versus injectable? Well, we can't give, because ephedrine's in there and caffeine's in there, we would not give that as an injection. Now, caffeine injectables are around. Ephedrine injectables are there. But like I said, they're only used in certain circumstances, and they have to be monitored when given. We're not going to give this out to somebody and have them start shooting themselves up with ephedrine and caffeine. It would probably be bad news, and probably some people would do it a little too much and put themselves in a bad situation and possibly end up in the hospital. All right, so that's one. So the ECA Stack Plus, Ching Seattle, that's definitely a good one as far as a fat burner. It's going to help you lose weight, burn fat. It's going to give you lots of energy. It's going to help you focus and concentrate better. It should help with not getting heart palpitations, no jitters. It should be nice, clean energy. You'd be able to focus, accomplish things, and burn fat. So weight loss is a great effect from it. And that would probably be your best one. As far as appetite suppressing, it will do some appetite suppressing too as well. And, when we start talking about that, phentermine is used as an FDA appetite suppressant. We don't really use that because phentermine is used and it's supposed to help you, as far as suppressing the appetite and your stomach, as far as you train yourself to eat smaller portion meals and better food sources. A lot of people don't do that. They use it as a crutch, and they build up a tolerance, and they have to just take it to get by now, where it's not really doing its job. And you shouldn't be on it because it causes nervous system problems and a lot of different other issues possibly if you're on it for long, extended periods of time. The medication is used properly, it could work well, but honestly, the ECA Stack Plus works a lot better because phentermine is like almost like a methamphetamine, okay? Like, it's like a stimulant as far as that goes. So it will help lose weight, I think, a little bit in the beginning if you're not eating and doing that and just being stim. But where ECA Stack Plus, the ephedrine, caffeine, aspirin, B12, and chromium, where B12 and chromium are actually going to help you boost your metabolism naturally, help you process fats faster through the liver, and then ephedrine and caffeine are going to work together synergistically, and they're going to help you get the energy. They're going to help you burn fat. They're going to help you suppress the appetite a little bit. So it's going to work really, really well, and it's going to keep working. So you can take it daily. It's going to work day after day after day, month after month after month. So at that point, that's really a better option for you. If you guys want the ECA Stack Plus, it's real simple and easy to do. You don't need blood work. All you guys got to do is fill out your patient paperwork. You'll see the medical provider, and then you guys should be good to get your ECA Stack Plus. Now, there are some caveats to that. If you do have super high blood pressure, you're probably not a good candidate for it. If you have serious heart conditions, you're probably not a good candidate for it. But for, I would say, the majority of the population that are healthy, it's going to be a good fit. It's going to work very, very well. And there's different dosages for different people out there. So, you could be on one dose and another person can be on another dose. It just really depends on your sensitivity to stimulants and how, you take them in and how you really feel on them, right? So ECA Stack Plus, I definitely recommend that for you. All right, 10-4. All right. HCI or HCG? HCG. All right, so HCG is good for weight loss. You can use it for weight loss, Ching Seattle. HCL, I don't know what HCL. Now, ephedrine HCL, that is HCL. And that's real ephedrine, not ephedrine extract or bark or nothing like that. This all comes from the pharmacy. It can only be prescribed. That's the only way you can get true ephedrine, HCl. You can't get it over the counter anymore. It was banned a long time ago because people were abusing it. Think about that, abusing something. You know, people abuse a lot of different things, but people were abusing it, taking too much of it, dehydrating, falling out, and dying. It's been definitely happened to baseball players and stuff like that. So it's not really good. All right. So yes, HCI Ching Seattle. I don't know if it's HCI or HCL, but HCL is what it was. Ephedrine. All right. Woo. All right. Okay. So I think that's a pretty good show so far. Let's get into the Titan Weekly Poll. All right. So this poll is great. I love to hear you guys interacting with this poll. I love to hear some of these answers that come back and really get to talk about it with you guys. So the poll is have you ever tried any bedroom enhancing therapies or supplements? Because I know I go into gas stations, they have these supplements for erections and stuff like that. And I don't know how good they are because I've never had to take them. And I think if I had to take them, I'd probably get the real deal instead of going into the gas station. Where going to the gas station is a little bit probably more convenient, or was back in the day. But now it's so convenient to get some of these therapies or bedroom enhancers. Literally, you're on your phone and you're doing your Skype or your FaceTime with the medical provider on your phone. Maybe at your lunch break, maybe in your house, maybe in your bathroom. Who knows? You have to fill out some new patient paperwork, and that's it. And the pharmacy ships directly to you guys. So it's real simple and easy to do. But I guess maybe people are in jams and they're in the gas station or whatever it is. But listen, by any means, let's talk about the poll. So the poll is really cool. Let's talk about it. How many of you guys out there are using these things? So 36.4% said no. I've never tried any bedroom enhancing therapies or supplements. Next one was no. Do they even work at 13.6%? The other one was yes, natural remedies at 22.7%. And then a yes, Titan therapies at 27.3%. So that was the second highest one. So no at 36.4%, and yes at Titan therapies at 27.3%. And then do they even work at 13.6%, and then yes, natural remedies at 22.7%. So it sounds like a good amount of you guys are getting Titan Medical Center therapies and using them properly, wisely, and for your benefit in the bedroom, which is awesome. You know, and then you have a lot of people that says no. Now, some of you may not need it, okay? Some of you guys might have a healthy sex life. Erections are good. No problems there in the bedroom, you know. Now, do you want to take it up a notch, maybe on an anniversary or a special day, or you guys are going to go out drinking and stuff like that? This is where this could come into play and maybe help you guys out. Not have to think about it at all. I mean, there's nothing like that. I don't know if you guys haven't taken them before and you guys do take them, you know, that's one thing that I can like basically tell you guys about. But when I took it, you know, my reaction was sometimes, you know, I'll be thinking about like getting in the mood and all this stuff. With this, it's no thinking. It's up, you're ready to go, and that's it. Done deal. So that's really the benefit of it if you haven't tried it before. Now, if you have tried natural remedies, what are these natural remedies? I'd like to know, you know, because I don't really know too many natural remedies that are really going to help you guys. I know there's some stuff like that, like horny goat weed and, right? Horny goat weed and stuff like that. Now, it's got a great name, but I don't know if it really works. Horny goat weed. Now, that's something you find in the gas station probably, right? Or one of those sex shops or whatever they are, or toy stores or whatever. So at that point, you might find them there, and I don't know if they really work. So if they work, great. Now, do you think they could be a little bit better? And the price-wise, I think it's about the exact same as getting something that's really going to work, guaranteed. You know, listen, when I take this, you're going to get that effect, and it's going to work properly, and you're going to be like Superman or Superwoman, whoever you are, and you're going to do your good deed for the day with your partner, okay? For the other percentage, you know, that basically, like, really, do they work? Yes. So I know therapies really do work. Bedroom enhancing therapies, as far as prescribed medications, that's why they're prescribed, all right? They come from the U.S. pharmacies. They do work. They're going to do what we say they're going to do as far as that goes. They're going to work. So at that point, you guys don't have anything to worry about. So if you do want to try those therapies, male or female, we got your back. We want to make sure you guys are having a healthy, uplifting sex life, right? Because everybody likes sex, whether you're bisexual, asexual, heterosexual, Everybody likes it one way or another. If not, why? There must be some traumatic thing that happened to you, or something that just, it goes against that altogether. I know some people are very religious and think that sex is very bad, where I don't understand that. Or something traumatic could happen to somebody. So, at that point, I feel for those people out there. And you shouldn't have to feel like that, okay?
I saw someone wrote a comment on Instagram asking about samples.
Samples. So there's no samples. Everything we do is doctor prescribed. And you have to see the medical provider to get it. So we don't hold these medications here at Titan Medical Center. They come from U.S. licensed pharmacies. So we can't just send out samples to people that want them. Now, if you got a therapy, like let's say Hercules Potion or Titan Complete or something like that, we could possibly do one sample for you guys if you guys are patients and you guys are getting the therapy, because they're coming from the pharmacy anyway. And at that point, they can be shipped with your package in there, and I don't mind doing one sample for you guys if that's the case, okay? I use only when I have more than one girl to satisfy. So, the Ching Seattle, man, you've been killing it, dude, killing it. So, I do know a lot of people like that, too, as well. They use it, if they're doing or having fun with one or more partners. So that way they're ready to go, even if they, achieve orgasm. They can still have the erection and go, and give pleasure. So, yeah, I've definitely heard of that before. I know some guys that are patients of ours, and they go out, let's say, to Miami for the weekend, and they get 3 girls with them, and God bless their soul. Everybody's different, so some people might think that's okay, and some people might think that's not okay. But this person's single, they want to have fun, they can have fun. These girls are all, willing and able. So at that point, they usually use these different therapies. So big ups to you, Chingy. Black Mamba works. Got mine at gas station. So Black Mamba, all right. So he's taking these Black Mambas, good for gas station. So it will compare the Black Mamba to something that we have. I guarantee, hands down, gonna be way different experience, man. Way different. But if it works, good for you, man. And listen, it helped you out in a jam. That's all that really does matter, right?
You don't know what's in it.
Yeah, this is true. So you really don't know what's in it. And that's what we pride ourselves on. That's what we tell you guys. Like, the one thing you are going to definitely know is what we say is going to be in it is in it, because it's prescribed and comes from the U.S. licensed pharmacy. So they can't just put anything they want in these different things. So, and females too, especially. So, especially with PT-141, females, when they go into these shops or they go into a gas station, there's nothing really like for them, right? It's mostly geared towards guys, not females. And where, these libido enhancers for females like PT-141 and stuff like that, they work excellent for females, and they were FDA approved for females. So at that point, they can use them and guys can use them. So really, you guys can get one therapy, use it between each other, and really have a great time. So Black Mamba Premium contains hidden drug ingredient. So we're just reading this as we talk about it. Now, this was in 2015, advising consumers not to purchase, use Black Mamba Premium, a product promoted for sexual enhancement. This product was identified by the FDA during an examination of international mail shipments. The analysis confirmed that Black Mamba Premium contains still... Oh! That's why it works so good, Ching Seattle. The FDA laboratory analysis confirmed that Black Mamba Premium contains sildenafil, the active ingredient in FDA-approved prescription drug Viagra, used for erectile dysfunction. That's why it works so good. Now, that's what I was telling you guys before. You really don't know what's in a lot of these different things that are over the counter. And some of these companies sneak some of these ingredients in to their products because they want it to work and they want you to buy more. And they're usually, it's a really hard chance for them to get caught because there's so many products out there that the FDA has to go through, analyze, and get back to. But being that sildenafil is in it, it's a prescribed medication, that's what it's going to do. So I'm sure it's definitely going to work if sildenafil is in it. Now, probably since then, I mean, if they're getting it now, they probably don't have that in it because they probably get fined or get taken off the market. So just a little tidbit. So watch out what you guys are doing. Make sure you guys are doing the safest thing possible for yourselves, all right? Woo! All right, events coming up. So we've got events coming up. October, we've got one guaranteed. October 31st, Mid-Florida Classic. We will be in Orlando at the Deke Warner Titan Medical Center presents Mid-Florida Classic, which is the bodybuilding show. It's been a pretty dominant one for a lot of years, and we'll be out there. So Come out with us, have some spooky fun. We're all going to be out there. I'll be out there. Street's going to be out there. Drew, Art, the whole crew, a couple of the girls, tight nets. So we're going to have a good time. Maybe we're going to be dressed up. Maybe we won't be. I have no idea. We still got to find costumes. So that's going to be one. November, we've got Carson Couture, I'm pretty sure, that's coming up. And then December 12/12, we have the Festivals of Speed in Orlando at the Ritz-Carlton. It's a hell of an event. We were title sponsors last year. Can't wait for it this year. So it should be a really good time. Guys, if you guys want to be involved in the poll and you guys want to get the new newsletter, all you guys got to do is text the word Titan Medical to the number 22828. So on your phone, you're going to put in the number 22828 and in the subject line or space where you're going to type to somebody, Titan Medical. You guys will be able to get involved with this newsletter, the poll every week, maybe learn about some of the new therapies we have, discounts, events coming up. And like I said, you guys can get involved with the poll. So you can be interactive with me every Tuesday and we can talk about these different things. Maybe you guys got some old stuff that we don't, right? You should be Hercules or Zeus, right? I should be. We should do maybe the Olympians. We could possibly do the Olympians. Titans and Titan goddesses. Yeah, Olympians. Yeah, for sure. That's a really good one, man. I appreciate it. Appreciate it very much. Yeah, I think we can definitely do that. So, I don't know. Are you guys dressing up? I guess we'll get into it next week. If you guys don't got a costume, because I ain't got one. If you guys do dress up or you guys go out to your Halloween parties and stuff like that, I know this year because of COVID and all these issues and problems, they're trying to cancel Halloween. They're telling people they shouldn't go out and trick or treat for kids. Like all these different things out there, which is really, really crazy. I think at this point. But I mean, I ain't got nothing to lose right now. I have antibodies. Some people don't. I understand some people are scared about the virus and stuff. So do what's best for you guys and stay healthy, stay safe, and do that for your kids and your family too as well. So it's been a great Titan Talk Tuesday, guys. I appreciate you guys tuning in with me every Tuesday, 6 p.m. Titan Talk with just me, John, CEO of Titan Medical Center. You can catch me Friday with Big Drew on Titan Lifestyle at 2 p.m. We talk about everything that's going on outside of Titan Medical Center. There's a lot of different things, especially right now. Crazy, crazy news headlines and crazy news going on. Every day is something different. So you guys can talk with us, chop it up, interact with us, and it should be really, really cool. Every Sunday, 11 a.m., the Titan Medical Center Health and Lifestyle Show. It's on ABC here in Florida. If you guys aren't here in Florida, you guys can catch it. Or if you guys are in Florida, DVR it. If you guys aren't, though, you guys can check out our Facebook, Titan Medical Center page, or go to YouTube, Titan Medical Center. That's all you got to look up. Go to our page, press subscribe, hit the all notifications bell, and then check out all our videos. And now we have videos from everything, from our lifestyle events, to our injections, to our therapies, right? To our Titan Medical Center Health and Lifestyle Show. All these different things you guys can check out on YouTube. Leave some comments on there. We'll get back to you guys. I really appreciate you guys tuning in to me every Tuesday, 6 p.m. for Titan Talk Tuesday. If there's anything else you guys want to hear about, or if you guys like the content that we're sharing with you guys, please, if you're on Facebook, share. Instagram, press the @ and then a couple people, just tag them. YouTube, like I said, subscribe. Hit the all notifications bell. Twitter, retweet. Do all that good stuff for me. I appreciate you guys very much. So you guys have a hell of the rest of the week to go on. I hope you guys have a great week. I'll see you guys Friday with Big Drew at 2 p.m. Thanks a lot, guys. I'm John from Titan, and I'm out.